Welcome back. The Ministry of Health now says the recruitment of Kenyan nurses who are meant to work in the UK is still on. This comes after the European nation announced the halting of the exercise. On its part, British High Commission in Kenya says the exercise was stopped to avoid cases of exploitation. And as Beldin Waliaula now reports, recruitment agencies have just been taken out of the equation, and now what remains is a government-to-government arrangement.
The Department of Health and Social Care in the United Kingdom has added Kenya to the amber list of countries, which basically means is a blacklist as far as the recruitment of foreign workers is concerned. This means potential employers and recruitment agencies must stop all active recruitment of health workers from Kenya with immediate effect. But for employees who had been given conditional offers prior to 11th November, the process will continue. The UK and Kenya signed a bilateral agreement in July this year, which provided a framework for future international recruitments. The UK wanted to tap into Kenya's unused labor force to curb the shortages it is experiencing on its end in the wake of COVID-19 pandemic.
This new MOU between the Republic of Kenya and the United Kingdom on healthcare workforce and UK-based health and education institutions on the establishment of Kenya-UK Health Alliance, I believe will create a platform for not just health worker exchange, but total capacity building of healthcare professionals, not only in Kenya, but also in the region, who will also take advantage of this partnership.
But the UK now says the decision to stop the current recruitment of Kenyan medics has been reached to protect Kenya against a shortage of health workers. The British High Commission in Kenya has refuted claims that nurses in Kenya will no longer have access to its market. In a statement, the British High Commissioner to Kenya, John Marriott, says the recruitment mechanism will continue and has been strengthened in accordance with the WHO Code of Practice for International Recruitment of Health and Social Care Personnel in the United Kingdom. On the steps to avoid illegal trafficking of workers, which may lead to exploitation, the statement clarifies that moving Kenya from green to amber means international recruitment is only permitted in compliance with the terms of government-to-government agreements. This will stop private companies taking advantage of the interest generated by the agreement between the two governments and stop uncontrolled recruitment. Meanwhile, some nurses who spoke to KTN News in confidentiality say most of them may remain jobless for longer now that recruitment agencies have been banned from recruiting from Kenya. About 3,000 nurses applied to work in the UK. However, Health CS Mutahi Kagwe had his take.
We sent 300 people to do the English exams. 10 passed. 10 passed.
The nurses have condemned the CS, terming his utterances as embarrassing and meant to expose them to public ridicule. Beldin Waliaula, KTN News.
To the corridors of justice, Deputy Chief Justice Philomena Mwilu can